We're Group 11, and today we're going to be discussing Provision 9 of the American Nurses Association Code of Ethics. Provision 9 in the Code of Ethics speaks of the profession of nursing collectively through its professional organizations and how it must articulate nursing values, maintain the integrity of the profession, and integrate principles of social justice into nursing and health policy. Provision 9.1 Articulation and Assertion of Values. The articulation and assertion of values in the profession of nursing are centralized around the promotion of health, prevention of illness, and alleviation of suffering. Articulating nursing values includes three principles in the ethics of care: respect for persons, justice, and beneficence. Beneficence means taking into account the welfare of another person and treating them with kindness and supporting their well-being. These collective values are shared by individual nurses and are represented by professional associations and organizations as a whole to unite the profession. Nurses who share the same values will think and behave cohesively in the clinical setting and act with honor and integrity. Articulation and assertion of values is important to nursing because a collective promotion and communication of shared values unites the nursing profession with the same foundation for deliberation and decision-making. Nurses in a position to think and act with the same mission and vision as their nursing colleagues across the profession. As a result, these shared ideals will properly represent the role of nursing to society independent of where each respective nurse is located. Also, articulation and assertion of values provides nurses with support and resources to contribute in healthcare because these values are highly evaluated. These collectively shared values guides nurses to think and act similarly and with confidence across the nursing profession. What if this provision were not in place? If nursing values were not present, the quality of healthcare and trustworthiness of nursing would suffer. The absence of a collective purpose and code of behavior will cause those in nursing to continually doubt the profession as a whole, and the public will question the safety and reliability in nursing. The provision constantly evaluates and critically analyzes the nursing values and ideals. Without a shared mission and vision, poor decisions will be made that affect patients, families, nurses, and healthcare administration. Thus, the best ideals and values are constantly reviewed and used to ensure that society and those in the nursing profession are able to depend on each nurse to think and act with excellence and integrity. Provision 9.2 Integrity of the Profession. Provision 9.2 is addressing the integrity of nursing, meaning ensuring nurses are practicing ethical and safe care. The best way to promote health in all populations is to show justice, fairness, and caring in nursing communities. This can also be done by promoting awareness and adherence of the Code of Ethics. To achieve integrity in nursing, many different factors must be present, including education, workforce, sustainability, nursing migration, and utilization. For all of the values and ethics in nursing to be followed, they must stand out and be obvious in all professional relationships. The Code of Ethics provides the agreement between nurses and society for the standards in nursing. Provision 9.2 is important because it creates ways to clarify a nurse's accountability to the public. An example of integrity in nursing can be seen in a nurse's actions when no one is watching. For example, properly discarding unused medications or proper documentation of nursing mistakes to prevent harm to patients. If this provision were not in place, nurses may be unclear of their expectations to the patients they are giving care to. The absence of the provision may also make the patients uncomfortable in nurses' hands due to vague guidelines. Provision 9.3 Integrating Social Justice. Nursing organizations must speak on behalf of all nurses to promote change to improve healthcare locally, nationally, and internationally. Nurses must be vigilant to address social determinants of health. The nurse must influence the following to address these social determinants: government agencies, legislators, and international bodies related to health affairs. Why is this important? It is the job of the student to learn to model the profession's commitment to social justice and health. Students need to learn the importance of unjust systems and know that it is their responsibility to address these systems. Nurses and nursing students must model the commitment to social justice and health through content, clinical and field experiences, and critical thought. What if this provision were not in place? Nurses would not feel the need to seek social justice and change in healthcare if the provision weren't in place. Nurses and nursing students must model the commitment to social justice and health through content, clinical and field experiences, and critical thought. Provision 9.4 Social Justice in Nursing and Health Policy. Provision 9.4 speaks of actively uniting with health organizations in the global nursing community, noting the concerns of the nursing community as a whole. It addresses the concerns that impact public health in the nursing profession. The nursing profession must work as a collective voice of nurses. Effective communication promotes the advancement of the nursing agenda for health and shared research through open and honest communication. Standing up for justice is more than standing up for the health care of the client, but also looking into the background of what is causing the illnesses. Nurses must uphold holistic ideals to maintain the protection of the environment first in order to promote wellness and restore health. Florence Nightingale created the environmental theory, which states that unsanitary environments contribute greatly to ill health and that the environment can be altered in order to improve conditions for a patient and allow healing to occur. Why is this important? To bring about positive change in the nursing community, be conscious of politics and changes that can affect nursing as a whole, as well as being a collective voice when changes need to be made to effectively change the quality of nursing for the nursing profession and the community. In order to be aware of the changes, nurses must work in agreement and effectively communicate the concerns that impact public health. This provision is important because nursing extends beyond just the patient, but includes the environment and public. If nursing focused solely on the patient, the background, the causes, and the effects would be disregarded. If solutions can be found outside the hospital first, perhaps health-related instances can be avoided. The public needs to be educated and informed on these health issues by nurses being active in the community. What if this provision were not in place? If the provision did not exist, the nursing profession would not have a collective voice to speak up in time of social injustice. There would be less advocates to stand up for the health care of the environment, which has a direct effect on the health care of the population. The environment would continue to decline, which would inadvertently harm the health of the population. Examples of this provision in our world today would include effective communication and combining the collected values of the individual nurse to represent the professional organization. The professional organization would utilize the ideas of individual to be the collective voice of nursing, participating in social change by actively engaging in the political process. Discussion prompt. Now that you have seen how nursing organizations have formed today, identify a professional nursing organization in our society and describe how this organization works for social justice and the values held within Provision 9. Thank you for listening to our presentation, and we hope you have a great day and rest of the semester.